My guest for this segment is Beth Lynch. Welcome, Beth.
Thank you.
Congratulations on your recent award and all of your achievements.
Thank you very much. It was a great honor, and it's wonderful to work for HealthSouth and at this level of care. Thank you for coming to share this with our community.
You're welcome. When a patient first arrives, how do you determine the plan of care?
Sure. We use the FIM, which is the Functional Independence Measure, and it's a nationally used tool that's standardized. It's a 7-point scale to determine the level of assistance that people need to perform different activities. So there are 18 activities, including dressing, grooming, bathing, walking, problem solving, speaking, and listening. We add all of those scores up and take into account the patient's diagnosis and any other diagnoses that they may also have, like diabetes or high blood pressure, and that gives us an estimated length of stay. So we're able to determine about how long the patient will be here. In addition to that, we do our full evaluations by each of the therapy teams: physical, occupational, speech therapy if it's needed, the nursing team, the respiratory therapy, and the physician, and we all assess how much assistance the patient needs and what they need to work on to be able to get back into the community.
HealthSouth requires 3 hours of therapy per day. Is that difficult to do with some patients?
Our license is for acute rehabilitation, so we're required to provide 3 hours of therapy a day. But we're able to break that therapy up depending on what the patient needs. So if a patient has very poor endurance, we can spread their therapies out, do short half-hour blocks of therapy, utilize speech therapy, other modalities such as hot packs or stretching of the muscles to help the patient get to that 3 hours. But all of those things are working towards the patient's goals and trying to help them get back into the community.
I think our viewers will be surprised to hear how many therapists there are at this facility.
Certainly, we have over 50 licensed therapy staff in our facility, and we each specialize in something different. So speech pathology, language pathology or speech therapy is sort of a misnomer. We work on a lot more than just speaking and listening. We work on speaking and listening, reading and writing, swallowing, and then also cognition, which includes problem solving, attention, your ability to hold your attention to a task for a prolonged period of time, decision making, problem solving. Physical therapy is more what people think of when they think of therapy. But our physical therapists also work on a lot of different levels of care. So some people need to work just on rolling back and forth in bed, or sitting at the edge of the bed, or sitting on a table. And then other patients are working on standing, walking, and even high-level balance, going up and down stairs, up and down a curb, up and down ramps. And then occupational therapy works on anything that occupies your day. So that's our activities of daily living, from getting up in the morning, making the bed, getting dressed, showering, shaving, preparing your meal, eating your meal for breakfast. All of those things are included in occupational therapy. The great thing about working at this level of care is that we all work together and we all integrate into each other's therapies. So you may see a physical therapist who has a patient standing, but they're working on naming the colors of the cones that they're reaching for. So you're incorporating a little speech therapy. Or an occupational therapist that's having their patient stand while they're working on a puzzle. So they're working on visual perception, but they're also working on their standing balance at the same time. So we definitely cross boundaries a lot.
Now let's talk more about the gym and the technology used to treat your patients. Begin with speech therapy, since that's your specialty.
Sure. We have VitalStim here, which is a neuromuscular electrical stimulation for the muscles of swallowing. So when someone has a stroke or a brain injury, they may have difficulty protecting their airway when they swallow, which can put them at risk for aspiration and pneumonia, food or liquids getting into the lungs. And so we can use this and we apply it to the front of the neck, and it provides a small electrical impulse into the muscles, causing the muscles to contract. And then during that time that the muscles are contracting, we're working on swallowing the whole time. So we're giving them different things to try to swallow and working on building the muscle strength to get them back to eating a regular diet and regular liquids.
That's amazing. How about physical therapy? What techniques are used to treat these patients?
Sure. We have the autoambulator, which is a weight-supported, you've seen it,
I remember.
a weight-supported treadmill system. So the patient is in a harness, and it allows the therapist to control how much weight the patient's putting on their legs, all the way from no weight at all to full weight bearing. And they can then work on the normal pattern of gait and walking and moving their legs. So that's a pretty cool machine.
Yes.
We also have the Bioness L300, which works on the front of the shin to help stimulate the muscles that lift the toe when you're walking. So a very common problem after stroke or brain injury, spinal cord, is that someone may have foot drop, so they can't lift their toes when they're walking, and that causes them to have a risk for tripping. So this machine works on the anterior portion of the shin and helps to contract those muscles to work on lifting the toes.
Let's move to occupational therapy techniques.
Sure, we have the Bioness H200, which is similar to the one for physical therapy, that works on the muscles of the arm to help with grasp and release. We also have the REO Go, which is a computerized machine that the patient has a stroke or brain injury patient with significant weakness in their arm has a screen that they can use for biofeedback. So as they move their arm, the symbols on the screen move to give them better feedback for what their arm's doing to help improve with strength and coordination and also pain reduction. We also have, we have lots of technologies. We also have a drivable program, which is a screening that has been approved nationwide to help patients get back into driving. So patients with neurological deficits that tests both memory and cognition as well as speed of processing to help people get back to driving.